It's springtime and we're excited to get out and get going. For those of us who push it a little too far, fortunately, Indiana Regional Medical Center has started some new services for the community. We're here with Ian in the Cath Lab. And Ian, tell us about the Cath Lab. What is it?
Okay, well, Indiana Regional Medical Center opened up our new interventional cath lab in November of 2016. We have state-of-the-art equipment. Everything is brand new here. We have the ability to treat patients very quickly and rapidly, having emergencies as well as doing diagnostic and other kinds of catheterizations.
What are some of the symptoms that someone would go through that would bring them to this lab?
Some of the warning signs to look for are things as simple as chest pain, and chest pain can be experienced by pain radiating to the neck or jaw and down the arm, sometimes even through the chest into your back. Some people experience pain just like gas pain or epigastric pain. Some people just feel just a weird sense of impending doom, and so all those
that
are
can't
symptoms.
Be good. Ooh,
all those can be symptoms that make you want to get to the emergency room to be checked out to see if you are having any kind of a heart event.
So here at IRMC in the Cath Lab, one of the new services you all have implemented, what goes on in this room?
Here in this procedure room, what we do is a cardiac catheterization in which we take certain pictures with x-rays after we're injecting dye into the arteries of the heart. Whenever we do that, we can identify if there's any kind of blockages, and while we're in there, we can actually fix those blockages now without having to send you somewhere else to be done. Prior to this program starting in November, if you would have a blockage in your artery that would be found, it would have to be taken somewhere else to be completed. We didn't have the ability to do that here at Indiana. Now we do since November, and we're very excited to be able to share that with the community and get the word out that we're able to take care of patients completely here.
Well, that's what I'm thinking. I mean, that really is a commitment to the community, which is you know, kind of relieving. I mean, that if should in the event something happen, the resources are right here in your backyard.
Absolutely, and the hospital invested a tremendous amount of effort, time, and money into developing a cath lab like this, and being able to offer that service to the community is very invaluable. We can treat patients just as a regular patient coming in here for a diagnostic case. We also treat emergency patients as well.
Speaking of that, you have a door to balloon kind of you know, standard. Tell us about that.
Sure. A door to balloon time is the time that it takes from the time that a patient comes into the emergency room until they get onto the cath table to get their artery opened up with a balloon. This would be a patient that is actively having a heart attack, so it's a true emergency. You know, the national standard for that is less than 90 minutes to be able to have a patient from the time they come into the hospital until they get onto the table to get their artery opened with a balloon of 90 minutes.
And how long does it take IRMC?
Right now we're looking at about 50 minutes. It takes us 50 minutes for our door to balloon times. We're very proud of that. We've had some instances where some of the EMS providers in the area, they're able to transmit their EKGs and transmit patient data directly to the hospital. And a couple of those cases, they've actually dispatched us and had us come into the cath lab and get prepared before the patient even arrives at the hospital because they know they're having a heart attack. And we are able to get here quickly and make sure that we take care of the patients quickly.
And that really is where the seconds, the minutes, they really do count.
Absolutely. Time is muscle, and we're trying to make sure that we get the artery opened up as quickly as we can in an emergency to preserve every bit of function that we can for the heart.
Wonderful. Thank you so much, Ian. We're here in the Cath Lab, and this is just one of the many commitments that IRMC has made to the community. And here we are in the brand new operating room with Dr. David Wilson. So Dr. Wilson, tell us about this brand new operating room and what it means to you as a surgeon.
Well, as you can see, we have a huge room, and we have all the state-of-the-art equipment, monitors, we have a boom, we have our drainage system, we have beautiful lights that we use during surgery. So everything that we can use for a top-notch surgery and helps our patients. It's better for patients' care, patient safety, it's better for surgeons, and it's just a good place to work.
I'm thinking that the better your, what do I say, resources of the facility as a surgeon, that you know then can translate to the patient, yes?
Well, in this era of technology where medicine continues to change, we have kept up with the most latest technology in our equipment, in our pictures taking, in our arthroscopic equipment, total joint equipment. So yes, it allows us to do what can be done anywhere else in this world for our patients here in our community.
Now, as chief of surgery, you're charged with a big task. Not only as a surgeon, but you're chief of surgery. So, what does it mean to you that the hospital has a commitment to medicine?
Well, with that, it means that the hospital is committed to put an abundant amount of money into the care for not just the community, but also the people that work in this hospital for the community. Because for the community to get a service, you actually have to have a facility with the proper equipment that allows us to do the job for the community. So when patients come into there to see this facility, they're excited about having their procedure because they're in a top-notch facility, and surgeons that work here are excited to work here because they have a top-notch facility to work in with top-notch equipment. So it's also good for people who come from out of town, visiting their relatives. They feel more comfortable when they come in and see a facility that's nice, clean, new, and it just looks really good for us, or the community, and for our patients.
And you have a perspective too, because you've worked elsewhere. So this isn't the only hospital that you have worked in. So your perspective is larger too.
Yes, I've actually worked in Philadelphia and in Pittsburgh, and I like it here because I like the fact that I have the same equipment that I have anywhere else, the same thing, I can spend more time with my patients, I can do more for my patients. And here, where they've actually bent over backwards to make sure you have everything that you need that's for your patients. And that's a big deal. That's a big deal for a surgeon especially.
I can imagine. Well, and it's a big deal for our patients too. Trust me, we want to make sure you're happy. But before we see Dr. Wilson, we have to go see the anesthesiologist. So our first visit is with the anesthesiologist, and we're here with Dr. Ronald Jasper, Chief of Anesthesiology. Now, Dr. Jasper, you played a hand in picking out this specific equipment, and we've learned that it is state-of-the-art technology, it's quite modern, but what does that mean to the patient? How does that translate down to them?
Yeah, this is the Draeger Perseus. We were the second institution in the United States to actually have this machine. So the machine actually is a much more accurate machine. It's the way the ventilation mode is. It's a turbine machine as compared to a rubber ballast system. And what that correlates down into is a much more accurate tidal volume. It has many, many ventilator modes similar to like an ICU mode. We can ventilate pediatric patients much more accurately. So there's definitely a better patient safety involved with this particular type of machine.
Without Dr. Jasper, surgery would hurt a lot, you know. You kind of in a way make it possible, which is great, but you mentioned a safety issue. So talk to us about the safety behind this machine.
Yeah, we went with this particular machine because it is definitely safer for the patient. It has a lot of safety modes involved with it that aren't in your usual machines. The ventilation modes are the key to this particular type of machine. We can ventilate patients that have a lot of COPD in a much safer mechanism. So again, larger patients, some very, very small pediatric patients. Again, it's just a much more accurate machine. There's a lot of extra safety features, kind of like the newer cars versus an older car. So if you think of it that way, you know, all the safety features that are in the new vehicles, this is what's coming out. We have the state of the art here. We couldn't ask for anything better.
Okay, and that's what I was going to ask you. When you're doing your job as the anesthesiologist, I'm thinking this would make your job that much more exciting, or you would have more confidence in everything.
Well, you know, in anesthesia, we don't like excitement. We like it boring.
That's probably true.
So it makes it safer, and therefore, you know, it's like in an airplane. You like a nice smooth takeoff, you like a nice smooth landing. You don't like excitement. We like those smooth takeoff and landings. Okay, so that it definitely does.
Wonderful.